Bet.
all fucking day. This fucking bitch calling me fat.
No
Amy.
way.
Welcome to Two Girls in One Apartment, sponsored by.
Maybe one. Don't say that because we're not getting paid for that BS.
Okay, we're not getting paid for it. It's just called a hope manifestation. Maybe one day, fingers crossed. So today we're talking about healthcare burnout.
But wait, you guys, we have to tell you that we recorded a podcast after a night out.
At 2:00 in the morning.
You guys have to pay for that
Because it did not disappoint, and all I know
It
is the
was just so
conversation.
bad.
Like, what the fuck are we saying? Don't remember the conversation.
Kind of too naughty. But anyways, yeah.
So stupid.
Yeah, so we were just shook, like, oh my god, turn it off. But it's low-key gold. But
it's in the archives. It's a good one.
I had to tell Ashley, she's like, we can't post. Well, we're both saying, like, we can't post it. But I was like, but if they paid and to watch it,
Still no
subscription
families
fee
allowed?
coming soon.
Yeah. Okay, so yeah, welcome back. Healthcare burnout, because we were both in healthcare. I only was for like not even 2 years, honestly. Like it'd be 2 years in October, so less than 2 years. But I was a medical assistant for podiatry, so it's just ankle and feet, which who would have thought? There's so much to go into that.
Sick. I was a medical assistant for like 4 years or so.
Yeah.
And I worked at urgent care, primary care, some specialty care, and high risk pregnancy.
Yeah. That one's the craziest one.
Honestly, that one was the most informative one.
Yeah.
Especially regarding like just being a woman. But how urgent care, I was ran through.
Yeah.
Like,
I could imagine.
Only medical assistant, even though it's a little town, but still, I'm sure there's people doing laps around me, but still, it's my first job.
Yeah.
Too.
Well, see, that's what I think.
I'm uneducated.
Like, okay, being a medical assistant, you do definitely get like a really huge burnout, but at the same time, I kind of think it is a good job for everyone to kind of start with.
I'm fine with it. I would not trade it for the world. And I learned a lot about health in general.
Yeah, I
how to take care of your health, really.
Right. I learned way more actually about diabetes than I did anything else, because that was like 80% of our patients. So
that's all it really is. That's why it's its own field too.
Yeah, exactly. Along with just like other things with surgery and stuff. But it's very informative. I don't regret anything. I love it. I wish there was more for our healthcare, you know, like where it's like for an office, I wish they could just staff more medical assistants so they're not.
Healthcare burnout comes from you're overworked, understaffed, underpaid.
Mm-hmm.
Overworked and underpaid.
And undervalued.
Very much so. But at the same time, it just depends on the doctor you work for, but you're undervalued to the top dogs.
Right.
But like
the doctors are mostly the best part.
Yeah, but like I think about like CEOs, like those people, they're like,
right.
Oh, it's just medical assistants.
Right.
To be fair, there's a pyramid scheme to it all, but
right.
Your foundational level, we're at the very bottom. It's the foundation of the practice.
Like I think most medical assistants that are like in primary care, I think most of those go to PA school.
Fine with it.
Yeah. There he is.
But yeah, we left healthcare. I wasn't voluntarily leaving, but it ended up working out that way. It was always part of the plan.
It was never your future. Like it never, like not even being like a nurse or.
Yeah. I really feel like the lifestyle that I want, call me delulu. We could talk about that some other time, but I want a Porsche. I will get a Porsche, and I'm not going to get no Porsche being a medical assistant. And there's more money to be made out there for not less work, but
not just, it's just always running around rampant. And when it's not even, along with running patients, when you're usually the only medical assistant and you're helping the doctor out with everything, and you still have other work besides just rooming patients. Like at least that's what we had administrative stuff on, like calling insurance and calling people even for the shoes and this and that, and then there was laser, and then there was other treatments. So it's like you had to do 500 other things, but it's like, well, you still have to run your doctor, and it's like,
And the doctor comes first.
and the doctor always comes first. And yeah,
Which, like, I doctors, if you don't, that just that term gives them respect.
yeah.
Fucking groundhog over there. But yeah, one time we had a patient who literally called our doctor by her first name, like,
I would hate
the
that.
side eye that I just gave you, because how dare you? She did not go to school and pay that much money just to get that title.
To be that much in debt.
Just to get called her first name? Hell no.
And you know what? I think maybe it's just I've only worked at one clinic, one little, I feel like doctors are somewhat overworked too. Like I feel like they
You're very yes, all the whole
they have
healthcare industry,
yes, like
really, but
everyone is just overworked because I don't know what's going on where like so many people need the doctor, and it's just overwhelming amount of patients. But it's like they make doctors see X amount of patients, like you have to be in and out in 15 minutes. Where has that ever been fucking like
insurance is a scam. It's the insurance companies that are making them do that, so that way they get more people in, which means more prescriptions, more people to charge. That's why.
And it's just sad because it's like I hate when I'm the patient, and if they're in for 15 minutes, it's like, wait, I had notes, like I forgot. But now being the MA, I can see how they're like, well, it was efficient. Like, that's good. But it's like it's just I feel like it's lacking. It's making more about money and lack of compassion in my mind.
Immediately, once money gets them, not that's a limiting belief for me.
That's true.
Because just because money is involved doesn't mean that it should
compassion.
be lack of compassion. It's just how people use money. But insurance companies are scams.
It's even like with my doctor, I told her, I was like, okay, I'm about to be out of insurance because I don't have a job anymore, blah, blah, blah. And she's like, okay, well, our self pay price for a visit is $75. Like, that's it.
Chances are it's cheaper to do self pay.
Yeah, because my copay was $45. So it's like, okay. And if I'm just going for literally every year and then just to like up on my prescriptions, if I just have to do $75.
Yeah.
Like,
there's people that do there's like providers that are now opening up their own practices, and it's all just self-pay.
I kind of like
and
that.
in some places even do their own type of insurance where you pay monthly.
The concierge ones, I think.
So that's how my dentist works.
Oh, really?
Well, I don't pay anymore, but that's what they offered, $40 a month, and I got 40% off on my cavity fill.
I remember that actually. Yeah, so it's kind of like that because I think the concierge service, it's like you're paying a monthly and or yearly fee to see them. Yes, it is it's like the same thing, like no insurance, and they can get whatever they want. They can be in their appointment as long as they want. They want an hour to get, to have this done, this done, this done. So it is the concierge ones.
Another good subscription plan, fabletics. Not even the girls are gonna be like, oh my god, yeah, like, and thinking that I mean that like fabletics is good.
No,
but no, the ideology of the fabletics subscription, I don't know why there's not more business owners getting involved in that.
Because so easy to sign up. First of all, the fact that I already have 2 accounts, and you know what's annoying is it doesn't really make it that easy to cancel, like to actually cancel. And so just too lazy. So in the beginning of the month, I'm like, oh, gotta cancel this one, gotta cancel this one.
Because
what if I forget?
Tell them how it works in the beginning. Like, what's your first good offer?
$15 for scrubs, aka being in the healthcare field. And it's like, if you're not provided scrubs, yes, you can buy some that aren't
you need
as
like 5 to 7 of them.
Okay.
No, I mean, like, you need a lot. You wear them every day.
And the 15, first of all, I thought the 15 was for all of them. It's just for one of them. But the other ones you still get at a discounted rate. And that's really good material. It works so well. They were my favorite fucking scrubs.
You guys, she's like, yeah, it even tells you they were originally $150 and you got them for $80. I was like, yeah, that's a scam. That's how they really get used to that way you could see the value. But
I'm one of those people.
What, as like business wise, I'm thinking first good offer,
yeah,
and then subscription, and then the quality has to be there.
It is so.
That's what I'm saying. Like you wouldn't be
Yeah.
like that's what makes people think these are so worth it.
It's true. That is true
And then
because
they
I
see
don't.
the saving, but I bet you they're tripling, quadrupling how much it takes to make them.
Yeah, and then it's just it's worth the subscription in the very beginning for your first like 80% off or whatever. And I swear after that, it just doesn't feel worth it. And then that's what it gets you to create more accounts because you're like, oh, just that first time offer is just so nice.
Okay, let's see. Do you still have your account?
2 of them. Because I couldn't figure out. I had to call to cancel. And they're like, you're the 70th person in line. And I said, I'm hanging up. Actually.
Dang.
I was like, I'll just cancel it for next month and revisit
That's how
it.
freaking Anytime Fitness was. I had that subscription for 3 years, went 2 times. I didn't know how to cancel it. And then I tried canceling it. That you have to come into the office. Like, bitch, I'm 3,000 miles away. And then the guy was really rude to me, first of all. And then I wrote an email again. I was like, well, I tried to cancel. I spoke with, and he didn't help me. And then she said, okay. They tried to call back again, and he's like, I'm sorry, I just didn't understand what you're asking. Like,
oh,
bitch,
yeah,
shut the
right.
fuck up.
He was mad he got caught.
I know. Like, cancel like $35 a month.
Yeah.
I went twice. Shouldn't even gotten it.
But yeah, either way, fabletics, such a
I'm
hard
making
one.
a business like that. Like, how could I switch that up?
Right.
Oh, coming to a business near you. Mm-hmm. I would do it like I could probably do like a journal, honestly, though, because there's this journal company that just does inserts. You get a cute ass binder.
Really?
And it's like 3-ring binder, and then you just do the inserts. Some of them are like terrible or put back in, and it's like a hard plastic,
okay.
And the paper is just, you get a stack of paper and refill it. That was my main goal.
That's cool.
And it's so cute. You can get different binders. And what if you just get like do it every like a monthly planner? Here's your February, here's your March.
Yes, because what if sometimes it's too busy and they just don't need that month?
Yeah. And like sometimes you can skip it, or you can what if you can't skip it? Or what if you just get a blank one? You can choose a blank one if you wanted.
Difficulty separating work from personal life. That is a hard one for some people. I know it's not for some others, but it's just if you're working in an office that's not really big, you're working with the same people every day, day in, day out. It's hard not to
be some kind of friends.
And especially if you're around the same age. Or even not, it's just like who you connect with in life. And if you're spending 40 hours a week with somebody,
you're gonna be friends. But
yeah,
it does suck when that shit takes a left turn and then it's like, wait, I have to work with you?
Yeah. It's like,
and we had like a little beef to squash. Oh my god, nothing's worse than going to work and being all eyes on me because everybody's been fucking whispering. I hated that shit.
It's the worst.
I was like, oh my gosh, let me just get to freaking work and get out.
Like nobody.
But it's like whatever at the same time because you are so busy. So you can like whatever. I have patients to deal with. I have work I can be doing.
People are actually sick, so it's like I don't.
People are always sick.
There's people always breaking a bone.
Oh my god! One thing we could talk about is you guys need to start taking care of yourselves.
That part.
Because Ashley has horror stories, but just my worst horror story in it, diabetes. Like, come on.
It's always diabetes.
But it was this guy, not really HIPAA, right? Not really. But came in, had a cut like this from a jet ski. Okay, no big deal. Then it kind of grew. He's like, oh, okay, I'll go get it checked out. Gets it wrapped up. Gross. And then we look at it. He's like, I thought it was part of the healing process. Like, it's green.
Your leg's gotta go.
It's green, literally like a chunk of his leg. Had to send him to wound care, just from a little nick. Like, if you see your wound growing, it's not healing pretty fast, you have diabetes and you need to go to the doctor.
And you need to be on medication. I don't give a fuck what anyone says. The medication does help. Like, there are certain ones that will help for your body.
For sure. But those ones will keep you alive.
It's definitely hard to see patients, though, either not have the education to take care of themselves, or it's even hard to see the ignorance, too. Because it's just like, when the patient doesn't care about themselves or their health, it's hard to watch. You can't do anything, but it's just that's hard to see too. And it's sad to even see like the uneducated ones too, because it's like, wait, you didn't know this? But it's like, oh, like I'm sorry that you've never been taught this.
Yeah.
Or I don't know,
It's not
but
even being taught from the schools, not from your
right,
parents.
right, right.
This is the education system.
Yeah.
But that being said, I feel like with diabetes, I'm sure you've seen that a lot though, because it's
Yeah.
more of a progress. Like everyone hears about it, but when you think when I think diabetes, it's like, oh, you're fat. But
Right, like it's a misconception
like
in a
you're not
sense
feeling your
of
feet, your wounds aren't healing. Like
there's
things are
more
going on.
yeah, you're not getting the proper blood flow or oxygen all the way down, and because you got blockages in your arteries, and then
like people will be stepping on nails and not feel it.
I think it's so
They
cool
go
though.
weeks, months, and like, oh, you have a nail, and they're like, probably stepped on it in 2008, but you don't feel your feet. Like that's so bizarre.
I know.
Like have holes in the bottom of their feet.
Yes, I think it's so cool.
Diabetes awareness.
Diabetes awareness.
Well, I hate though when people are like, you're like when you're like African American, like, well, diabetes is runs in the family, like because of the food. Diabetes type 2 is a lifestyle disease,
Yeah.
not freaking hereditary.
Yeah.
It's not. That pisses me off. It's not hereditary.
Well,
type 1 is.
No, type 1's an autoimmune.
Okay.
Type 2 though, there is a huge, I could be wrong, I'm not doing the research, but there's a huge correlation though in like people who are diabetic, and you're like, oh, anyone else in your family diabetic? Like, oh yeah, like my mom's side or this side. There is a lot of people related.
But I think it's more cultural
Of their environment, of what they were raised in, and probably.
If you're Mexican, you're all eating beans, tortilla, rice.
Yeah.
If you're African American, flat fried food, goodies, good seasoned food. That's why it's a lot of ethnic backgrounds that are diabetic, and there's obviously going to run in the side of your family because it's the same freaking ethnicity, race, whatever you want to call it. And a lot of white people don't have it because they don't season their food. But you guys eat healthier though.
But it's also like that's why like
Greek food is the best diet for you. Mediterranean food is the best diet for you. Like, okay, if you're Greek, it's like it doesn't run in my family. Like, no shot, you guys are eating olive oil and nuts all day. And raw veggie. Like that's why it makes me mad. But it's like,
because it's like
not mad, but it's just like, yeah, it does run in my family because we're all black.
But it's also like, because it's like, okay, like come on, just work on yourself, just do the proper, try a little bit, and don't have this like
choose the healthier option, whether it's 2 honey buns versus 1.
And we get that there are things that people like. Addiction is a real thing.
Addiction.
It is a real thing, and it's also taking into people's account of their mental health as well, because that's a huge thing. Because if your mental health is down in the gutters, you don't give a fuck what you're eating. You don't give a fuck about like your health. You probably wish you were dead. Blah 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 blah. So because
cooking is self-care.
Yeah,
cooking for yourself is a form of self-care. You're going out of your way to like take care of your body, and it's a form of self-care. So if you can think about cooking as if you're doing a face mask, boom, done.
Yeah,
like enjoy it like it's a spa. Like treat yourself to a nice cooked home meal.
And it's nice to, because what I've been trying for myself just to eat healthier is I'm trying to be like, okay, I need to feed my body this stuff because I know it's good for my body. So
that's good.
Like put the damn spinach in the meal, because
eventually you'll start craving it though.
Yeah,
like once you build a habit, it becomes a routine.
I really have kind of dropped the chocolate obsession.
Yeah, Ashley used to eat a whole bag of Reese's in one sitting. Still body tea, but god dang, that's rich.
I love chocolate. Milk. And like there's no such thing as too much chocolate. Love
7-layer chocolate cake. You're Matilda. You're the other girl.
First I'm fat, Amy. Rude or aggressive of patients.
Yeah, some of y'all be mean to your healthcare people. Like, oh my
It's so
gosh, you
fucking
make it hard to
rude.
be there sometimes. But
And
because the job is very, very rewarding.
right.
That's why, like, it's you're there for so long because like you do build bonds with your patients, and it's like,
Yes.
oh, I'm helping these people, and it's so nice when you get to see people come in shitty as fuck and leave like a little bit of a smile on their face.
Or it's
It's
like
like, okay,
sometimes
they
when
came
they're
around.
it's like when they're shittier to like the other people, but it's like not to you, and they're like super
Yeah,
nice
they're
to
like,
you.
don't
You're
worry,
like,
I got it.
it's fine.
Hmm.
It's just this person. It's fine.
But yeah,
I remember and it's nice to turn a patient too, because I had
mm-hmm.
one when I switched over my doctor, and she was like, I literally roomed her plenty of times, and she's like, and you are? I was like,
Like, oh, enough to recognize me now.
okay. And then once I became like the official medical assistant, she actually was really nice and she was really cool. But in the beginning, it was just kind of like really bitchy and just, and you are like, what the fuck?
Like, your nurse.
Miss her.
Yeah, I feel like it's also a mindset game doing healthcare because urgent
Yeah.
care, obviously, every patient's a random patient.
Yeah, you never see the
And
same.
so, like, they don't owe you any kind of remorse.
Right. They can
They
talk
can
to
act over and be gone the next day. So it's like, okay, come on in. And it's like,
Yeah.
I approach every patient the same way. And what you doing? What's going on? You have to talk to them, like, just hear them out. People just want to be listened to. Like, okay.
Yes. And
But it's
sometimes
like
they tell
easy
you
sometimes.
the craziest thing.
Oh,
I've had like 3 of them.
probably from the
They're
same patient.
No, it's literally there's a
That one guy.
demographic of women.
Women.
Yes, that
A demographic.
yeah, usually in their later life, like 50s, 60s
Uh-huh.
type, in that, after
Age
menopause part.
range. Oh, okay.
Where they just don't have a filter and they just kind of want to tell you things, but they want to relate to the younger crowd, so they try to say things, and it's like, we don't really want to hear about your sex life.
Yes.
Like,
one patient was like, I was a little promiscuous back in the day. You know how it goes. Like, oh, and look, you're back in the same seat doing the same things.
Mine was just like, what was it? There was 2 different ladies, and they were both talking about like, having a situationship, and then getting mad at being like, yeah, he hasn't talked to me in a couple days, and like, I can't believe I did this. And I went over to his house and did this, do this, and it's like,
shit, we just had that same conversation yesterday. I'm just kidding.
oh my god,
Men never change. We never do either, though.
That part.
You just get bold with it. Women get bold.
Mm-hmm.
Well, they all get bold when they get old. You stop giving a fuck.
It's exactly what it is. It's just so funny because you're just like, okay, they're being genuine because they're telling you, but you're just sitting there like I didn't.
Well, people tell their doctor everything. It's the only person that listens to them, I guess. Because when I get to the doctor, I freeze up. I'm like, I'm fine. I don't need help, and like my fucking legs castrated off or something. Like, just it's okay. No worries. It's probably just being over dramatic.
Like, it's fine. You have somebody else to treat. It's okay. Don't worry about me.
I hate going to that. Like, what's going on? Like, I don't know. I forgot.
That was my fucking pet peeve. When patients come in, like, what brings you today? I don't really know. Like,
yes, you do.
like,
No, you should. I would hope.
Like, it said you made your appointment for this. So are we still with this or not? Like,
so
what are we
got
doing?
a cough? What's sore throat?
I did, but it went away. Okay. Cool. What's next?
You're feeling better now, then? I know. Like,
you're like, can I get Valium?
I really need cough syrup.
She really needs Adderall.
Stop it. Yes.
Start her job. And some people really do make a career out of it too, because it's like either like back office supervisors. You can get in with even being like learning stuff around the office, like office manager.
Yeah,
because
medical billing.
Because most office managers were medical assistants at one point too.
Which is how it should be, because then you know how it goes.
Yeah.
But then even so, it's a great job because you're in a needed field.
Yeah.
But a respected field.
Yeah.
And you can usually sometimes they'll invest in their employees and you can go up
Yeah.
the ladder like that and go
Mm.
to school paid off, or
Right. There's a lot of medical assistants that start as a medical assistant so they can get into radiology.
radiology
So
and nursing. So
and nursing. So it's like it's always a good starting point, but then there's just other things too cuz there's so many like technician things too, like a laser tech or doing
ultrasound, which is
the
radiology though.
yeah, and then like the other test we did, the peripheral arterial disease one, where it's like there's you can learn side like testing and x-rays and get certifications along the way. So I think it's definitely an easy burnout, but it's worth it to figure out.
For sure, you learn work ethic too.
Yes, and patient care and just common sense, honestly, and just learning how to deal with the public.
Socializing
Yeah, that's a big one. That is a big one.
and like educated conversations, because when the doctor talks, you shut up and listen. Nothing pisses me off more when someone's like not professional in front of a doctor. When it comes time, like,
Yeah.
this is health, this is still someone's life, like act right.
Yes, for sure.
Especially when like when doctors will come like emergency and like someone's still trying to continue the conversation, like, no, I look bad.
I wish there was no burnout. I feel like if there wasn't a burnout, I feel like more people would want to do it.
People do it. This is a growing industry.
That's true.
People are doing it, but it's just like it could. I think my problem was it felt like a job and I wanted a career.
100%. We're getting cut off. um, yes, it does feel like it doesn't feel like a legit career.
Mm-hmm.
That's the problem.
And like you can't go like. To be honest, I just like felt like I'm just a medical assistant, or it just didn't fit the person I'm trying to embody, I guess.
I feel like I'd be more proud of saying, "Oh, I'm a nurse," rather than like I'm just a
Yeah,
medical assistant.
for sure.
Like,
but then it's like now we're business owners, so that's even better.
Business owners,
because like our name is our business,
and we've learned good work ethic through our medical jobs. And how many? And it's like, okay, seeing different patients every day, like, okay, seeing different customers and blah blah blah, knowing how to talk to them, and
yeah, building like a professional relationship with people.
I agree. Well, that is our episode on healthcare burnout. No recapping. Okay, so at the end. Okay, so our end segment. What are we grateful for, either today or in general?
Whatever feels right.
Okay, so
there's just no rules to it.
Okay, so something that I am grateful for. I am grateful that I am a breathing and I am alive.
Okay. Me too. Okay, I am grateful for knowing it's coming.
Ooh, that's a good one. Like in feeling it too.
Yeah. And just like I'm in the moment of rest, like
moment of delulu.
Yeah, and like resting, like not resting but trusting.
Yes, trusting the process, trusting the faith, trusting the wins.
Fine with it.